The World Health Organization has designated 2020 as the year of the nurse and the midwife. And this is just a very special time for nursing to be recognized.
Florence Nightingale was someone that really was patient-focused, focused on caring for patients, both mind, body, and spirit. And I think our nurses exemplify that here. We not only take care of the person physically, the patient physically, and the family for that matter. We all really strive to connect with them on a personal level in terms of their spirit, psychological well-being, and that type of thing. So I really do feel that our nurses exemplify the Florence Nightingale model.
So my wife is a nurse at UF Health, and I see it every day when she comes home. I see what she brings home. I see what she grapples with, and what it shows me is that she cares, and our nurses care, and the things they're willing to sacrifice for their patients. I've seen lots of nursing staff come in on their days off to celebrate birthdays, celebrate discharges, celebrate the end of chemo treatment or something, which is such a big sacrifice. Days off are so precious, and to see people forfeit those in order to appreciate their patients is really something.
My relationship with nurses is all over the place. Clearly, as a person in this field, I interface with nurses all day long. But my first exposure ever was my mom and her friends. And so my earliest recollections are of people that were warm and comforting. I couldn't tell you what a nurse did when I was 5 years old. Certainly by the time I became 10 or 12, I had a better understanding. But the earliest memories are of people who were just caring and nice.
Most healthcare providers, including physicians, we are so focused on one aspect of patient care, but what I have seen from a nursing standpoint is they look at a patient as a whole. They not only take care of patients from their healthcare standpoint, but they take care of them from a mental health, social health, and emotional and spiritual health. And I really cannot think of any other profession which takes care of patient as a whole. And being a patient and having seen that, I really appreciate that.
I worked as a nurse's aide for about 6 years. I think a lot of the things that I learned during that period of time were taught to me by nurses. I think being able to develop a gut feeling that a patient's sick was taught to me by nurses. Certain skills that I don't think I would have ever learned had it not been for them and for that job.
Many people may not know that my first job ever was as a nursing assistant. So I was a nursing assistant at George Washington University's emergency department. And I got attracted to emergency medicine, interestingly enough, not because of the physicians who were there necessarily, but because of the nurses. I saw how compassionate they were and how they were able to handle almost any situation in an effortless manner. I think in many ways they helped to direct my career. And I still remember Wanda. I still remember a number of people personally who I think I really looked up to when I was a nursing assistant.
It doesn't matter if the person graduated 50 years ago, 5 years ago, they all tell me the same thing, that the Shands nurses, the UF Health nurses, how much of an impact that was. Literally, the nurses that graduated 50 years ago tell me that. And the nurses, the students that I have in my senior honor seminar say the same things, that it's the Shands nurses and what they do and how committed they are to excellence.
I think the impact becomes very clear when a nurse takes care of either you or a loved one, and in this particular case, my mother. My mother was a cancer patient, and I brought her here to UF to receive chemotherapy. The care was extraordinary. From the nurses in the emergency department, the nurses on the floor, and finally, I would say the nurses in hospice were incredible. how they actually really were so compassionate with her and how skilled they were with her made me really feel proud about where I am and what we do every day.
Sometimes the patient is unresponsive. So then your focus turns to their spouse, to their child, to their family, to their mother, their father, whoever is there. You're actually intervening for them. You're comforting them because they know the nurse is caring about the patient.
I've seen nurses that go above and beyond. I think probably the most important one to my family has been the care of my daughter. My daughter unfortunately passed away from a brain tumor at the age of 6, and UF Health nurses cared for her from diagnosis through her death. They did that compassionately. They did that in a way that honored her, that honored us, and I think is just a testament to what people can do when they take care of someone else.
When we had our daughter born 4 years ago, my daughter came in really premature. My wife had a lot of anxiety and depression during this entire episode, and I could see the nurses sitting down, holding her hand for hours together and comforting her. And it was our first child. We had no idea how to take care of anything. The nurses not only taught us how to handle a kid, but how to feed, how to change. And they could see that as new parents, we were overwhelmed, so they would actually take our daughter for a few hours at night so that we can get some resting sleep and we can function well that day. And that entire hospitalization and the care that we have received from nursing has touched us so much that to date we are extremely grateful and thankful for what they have done for us.
Right now, we're living through extraordinary times. And I walked onto one of the floors that is working with patients that have the COVID-19. And I talked to a nurse and I said, thank you for what you're doing. I appreciate all that you're doing. She looked at me. She said, Ed, I'm a nurse. We got this.
I'm so proud of what we do, and especially now under our current circumstances where we've got so much going on. Our nurses are at the forefront of this battle against COVID-19, and I want to make sure I acknowledge that and thank them every day for what they're doing and for the sacrifices they're making.
I see what our nurses give here at UF Health to their patients, and I'm very thankful they're with us.
I really can't say how much I appreciate all the care that the nurses here at UF Health have given me, my family, as well as the patients that I care for.
I would really like to take this opportunity to thank you, all the UFL Shands nurses, for everything that they do to make an impact personally and professionally in taking care of our patients.
To our UF Health nurses, you matter so much to the care of the patients. Thank you for all you're doing.
Thank you, UF nurses, for everything that you do every day. We appreciate you, and we love all of the work that you do.